Okay. Okay, hi everyone. We're about to get started. Sorry we're a bit late. It'll just be Dr. Yaffe today for 30 minutes, one question, one follow-up, and I'll turn it over to her to give some remarks.
Thank you very much. Good afternoon, everyone. I hope everyone was able to enjoy their Easter weekend and virtually meet up with your friends and family. I also want to take this opportunity to thank everyone in Ontario for doing all that you are doing to keep yourself and those around you safe and healthy. Thank you for staying at home as much as possible, and when you do go out, for practicing physical distancing. As the weather gets warmer, I know this can be hard, although the weather today is pretty lousy, so hopefully you're at home. I know it's difficult for parents with children who just want to get out to the park to play or meet up with your friends. And I know it's hard not seeing your loved ones. But this is what we must all do to flatten the curve and to beat COVID-19. And to our essential workers, cannot thank you enough for all your hard work and dedication in these uncertain times. So where are we now? Looking at the data from as 4 p.m. yesterday from the public health units, there are a total of 7,470 confirmed cases of COVID-19 in Ontario reported. This represents an increase of 421 confirmed cases from the day before. Of these, 55% are female, almost 40% are 60 years of age and older, and 54% reside in the Greater Toronto Area. Unfortunately, we've had a total of 291 deaths reported, which is an increase of 17 deaths from the previous report. We have at least 89 outbreaks reported in long-term care homes and 120 deaths related to these outbreaks, some of which are lab confirmed, others are just epidemiologically linked. We do continue to see an increase in the number of resolved cases. We're now up at 3,357 cases, which represents 45% of all our cases. The number of healthcare workers who have tested positive is now 813. This is a cumulative number and is not representative of those who are currently positive. We have 760 cases who are currently hospitalized. Of those, 263 are in ICU, and of those, 203 are currently on a ventilator. In terms of our lab testing, we have tested over 108,000 people in Ontario. 1,534 are currently under investigation. In the last 24 hours, we have tested over 5,000 people, and almost 5,500 tests have been processed. The day before, we tested approximately 7,000 people. And as you know, we are working toward testing 8,000 people within the next few days. The number tested does vary. It depends on who shows up at assessment centers, how many outbreaks we have, and the testing that's done in those circumstances. So with that, I'll open it up to questions. Thank you.
Okay, we'll take questions from the first caller.
Your first question comes from Lauren Stone with the Globe and Mail. Please go ahead.
Hello, Dr. Yaffe.
Oh.
Today, the Premier was adamant that everyone in long-term care, sorry for the echo here, I don't know what's happening. The Premier was adamant today that everyone working in long-term care and every resident in long-term care should be tested for COVID-19. Is that going to happen?
We issued, through the Chief MOH directive for increased testing, which expands the groups who will be tested significantly. And we are in the process of developing and implementing the implementation of those guidelines at this point. One of the top priority groups, as you know, is long-term care residents, retirement home residents, and staff. So, of course, we share the Premier's concern, very much so, and do expect a very significant and meaningful expansion. In those directives, if there's even one person in those facilities who has any of the symptoms that may be suggestive, and we added and expanded that list of symptoms significantly, then that person will be tested. The people around them will be tested. The staff will be tested. And in fact, asymptomatic people will be tested. So out of an abundance of caution, the local medical officer of health, in consultation with the home, may in fact decide to broaden the testing even beyond that. At the end of the day as well, each doctor or clinician can determine who should be tested. So our guidance is, yes, expand the testing within the criteria of the directive.
Follow up?
You've also previously said, though, that widespread testing everyone in long-term care is ineffective. So can you explain your past comments on that? And can you also explain why the updated guidelines do not recommend that in the case of an outbreak, every single person in that home, whether they have been in contact or not, whether they have symptoms or not, should be tested for COVID-19?
So testing every single person in a home, especially if there's no evidence of an outbreak or a case, is basically, it's a snapshot in time. You may pick up something unlikely. You may pick up nothing, and you may be wasting a lot of tests that should be done on other people who are in an outbreak situation, or in the other groups that are very high priority, as you know, are patients in hospital with acute respiratory infections, people with symptoms in remote communities, Indigenous communities, and first responders. So we do want to focus primarily the initial testing on people who have symptoms, who are potentially suggestive of COVID-19 in these groups. But once we have somebody with symptoms, we broaden the testing beyond that.
Next question.
Your next question comes from Siobhan Morris with News Talk 1010. Please go ahead.
Dr. Yaffe, in his update earlier this afternoon, the Premier talked about seeing a glimmer of light. Looking at the numbers as they are, can you be specific about where that hope seems to come from?
Well, I mean, I am very hopeful as well, but also, with an abundance of caution and not assuming anything, because we have to keep working at the physical distancing and all the measures that we have in place. Our numbers, generally speaking, the number of new cases each day has been going down slightly. Not exactly, but the general trend. And the modelers have told us that the peak is likely going to happen this week. So assuming all the measures in place continue, all the public health measures continue. So I think, if they're in fact correct and things continue, after a peak, usually things go down. So in fact, in epidemiology, the epidemic curve usually is symmetrical. So, which means there will still be cases, but we'll be on the downside. And so that does give me a glimmer of hope, but with some caution built in.
Follow up?
And I'm not sure if it was you or Dr. Williams last week had indicated that you were keeping an eye on the fact that the number of cases in women seem to be gaining on the ones in men. I think today we've seen those numbers flip. And so do you have any reason to have concern about that change, or does that tell us anything about how COVID-19 has been moving or changing?
The numbers that I have say right now, 55% of the cases are in women. So it's interesting because my read of the data from Europe is it's men predominantly. I wonder whether it really has to do with exposure. And who's exposed to the virus and who gets tested. For example, long-term care tends to be older people. Men tend to die earlier than women. And so perhaps there's a preponderance of women. I think it's just hypothetical at this point. We have to keep watching the data.
Next question.
Your next question comes from Allison Jones with the Canadian Press. Please go ahead.
Hi, Dr. Yaffe. You just mentioned that we may see the peak this week. If that does happen, is there a point in the curve that you would be looking to then start providing advice that some of these restrictions could be lifted? Is it as soon as the curve starts to go down? Is it when it's nearly to the bottom of where it was when we began?
I think that's a decision that will have to be taken very carefully in consultation with the modelers and a lot of other senior people. And it will have to be, when it is done, it will have to be done very carefully and slowly because we don't want a resurgence. And, the fact is right now people are staying at home. People are not interacting closely with other people. Which is wonderful. But if you open it up too quickly, the virus is still around and people will get it. And so we don't want that. And so I can't say exactly when, but it's a decision that will have to be taken carefully.
Follow up?
Yeah. Is there anything that we can read into the fact that the hospitalization numbers seem to steadily continue to be going up, but the ICU and ventilator numbers seem to be relatively stable?
Yeah, I'm not sure about the significance of that at this point. We're continuing to monitor very closely and also make sure that we still have capacity for people with COVID-19 if they do need hospitalization or to be in ICU or ventilator. And right at this point, we're looking okay for capacity, which is great.
Next question.
Your next question comes from Rob Ferguson with the Toronto Star. Please go ahead.
Hello, Dr. Yaffe. We were talking with the Premier earlier today about the fact that it's just a strong recommendation that nursing home workers not work in more than one nursing home. Do you wish, given what has happened in nursing homes with the death toll, that had actually been banned? Would that have been a smarter public health decision to make? I know BC's already made it some time ago.
I think that the fact that people work in multiple facilities is definitely contributing to outbreaks and not just COVID-19. However, changing that is not a simple thing. It's certainly not within the power of public health to make that kind of change. We can recommend it, and I know it is being strongly considered.
Follow up?
What kind of a difference would it make now? And could it be done now? Or would that cause too much turmoil in nursing homes that are already dealing with enough?
Well, all I can tell you is I understand that it is being strongly considered, and it isn't a small thing to do. It's not a small thing to change, that's for sure. It's been discussed at the federal, provincial, territorial table multiple times. My understanding is BC was able to do it, not easily. I know others are thinking about it. Would it have an effect now? Yes, I think it would still have an effect.
Next question.
Your next question comes from Alison Martel with Reuters. Please go ahead.
Thank you. Dr. Yaffe, have you or Dr. Williams given any specific advice to Children's Aid Societies about how to handle visitation during this period?
I'm not aware of any specific advice or questions in that regard.
Follow up?
Opinions as to whether there should be blanket halts to visitation?
I really can't comment. I think we'd have to take each case on its own merit.
If you want to have another follow up, Allison.
I think that pretty much covers me. Thanks.
Next question.
Your next question comes from Christina Tenalia with CP24. Please go ahead.
Hi there. Thank you so much. My question for you, Dr. Yaffe, is, and you may have addressed this before, perhaps it's worth addressing again. We're hearing someone who went for a test was told by a nurse that there's a 30% false negative rate, meaning, of course, that someone with negative results might actually have the virus. Would you say that number is consistent with what you know?
That is not consistent with what I know. I've had many conversations with Dr. Vanessa Allen, who's the chief microbiologist at the Public Health Ontario lab, and the test is extremely sensitive and specific, as in over 90%. So I've never heard that figure before. I think the test is actually it's an excellent test.
Follow up?
Sorry, just to clarify on that question. So then the false negative rate would be what, about 10%? You said I believe you said a 90% success?
I don't have the exact figure, but it would be extremely low, lower than 10%. It would be very low.
Next question.
Dr. Yaffe. Oh, can I ask one more?
Sure.
Please. Yaffe?
Sure.
So you spoke briefly about the peak is on its way, and that was my question when we take a look back about 2 Fridays ago when we learned about the province's modeling. Would you say we're at this point where you expected us to be?
I'm not sure that I expected anything specific, to be honest, because I'm so busy working on it. I think that it's going as well as it can, but there's always room for improvement. But I think the biggest thing is people are complying generally quite well with staying home. And I know it's not easy, and that is the most important thing. And I think that's what's mostly contributing to whatever success we're having so far. So they need to continue.
Okay, we have to move on. Next question.
Your next question comes from Phil Perkins with CHCH News. Please go ahead.
Hey there, Doctor. Global News profiled a family in Oakville who were out rollerblading in a parking lot at a park, and were fined $880 by bylaw officers for not following social distancing, but they were all immediate family living in the same house. Do we need to be clearer to bylaw officers and municipalities on what can and can't be done?
Well, I think that in each municipality, the local public health unit is working with bylaw, and if there are questions or concerns, that they should call the local health department to see if there needs to be further conversation with bylaw.
Follow up?
And I read that we might be seeing more modeling. You mentioned them as well about how we could see a peak this week. Is there going to be another announcement at some point this week about what we can expect? Is that going to change to what was initially forecasted 2 weeks ago?
I am not aware whether there will be another announcement or not about modeling, but I know that the modelers continue to work on modeling, and they keep getting up-to-date data from us. And I expect at some point there will be an update.
Okay, next question, which I believe is the last question.
Your final question comes from Heather Wright with CTV News. Please go ahead.
Hi, Dr. Yaffe. I wanted to see if you had any information in terms of what is of the most critical shortage when it comes to PPE here in the province, and where those that equipment is needed.
Do you mean which type of PPE or which people are most missing it?
Which type? Is it masks? Is it gowns? Is it, shields? What type of PPE is of most need?
I believe it's mostly the masks. There's a whole team of people working on PPE, and I'm not part of that team. I get high level updates. So I think the biggest issue has been in masks. But again, right now they're doing quite well, and they're working really hard around the clock to keep making sure that we do have enough N95 and surgical masks.
Follow up and last question.
And I understand and appreciate that you might not be privy to all this sort of on the ground information, but I wanted to see also if, with Alberta sending PPE to Ontario, Quebec, and British Columbia, is there anything in particular that you know of that they are sending, and will those products, that PPE be sent to long-term care facilities as well?
I don't have the list in my head, but I know it was publicized exactly what Alberta is sending to Ontario, and it's a significant list, which is really wonderful. And yes, absolutely. Some of that will definitely go to long-term care. I think it will be allocated to where the need is the greatest.
Okay, thank you, everyone.